Hi, I'm Dr. Shilpa from Bangalore. So today we'll be talking about one of the categories of high-risk pregnancy, that is diabetes during pregnancy. So in diabetes during pregnancy, there are two sets which can happen, two situations. So in this, the first situation is like either the woman is already diabetic and then she gets pregnant, or she is pregnant and then she is detected to have high sugars when we do a blood test on her, and it becomes a gestational diabetes. So in these two things, there are various aspects that we need to discuss. So it is quite the same what actually involves in the treatment protocol, but at the same time, I mean, in a patient who already has a pre-existing diabetes, so one important thing is that they should check their sugar levels before they are trying for pregnancy and make sure that their HbA1c levels are less than 6.5 when they get pregnant, so that the problems to the baby, that is the developmental issues, the congenital abnormalities to the babies, are quite less if the sugars in the mother are in strict control before they get pregnant. So these sugars will definitely alter the quality of the egg, and it will cause certain chromosomal abnormalities, and also it can cause the cardiac defects, that is the heart problem in the baby. And there are other few things which it can cause, which is very specific to the diabetes, but it is not a very common thing. So what are we looking at when we are talking about diabetes during pregnancy? So one, the mother's sugar should be strictly under control. The mother should be having enough nutrition and gaining enough weight for her to sustain the pregnancy. 3, the fetus should be growing with the right amount of nutrition, and also the weight of the fetus should be normal, as at par with the Indian babies. So these 3 aspects should be balanced very well for us to say that our management or our treatment during diabetes in pregnancy is optimal. So if one of these parameters are not met with, say like for example, the mother is not gaining weight, the mother is anemic, the mother is feeling tired all the time, but the baby is gaining weight and the sugars are normal, then still the pregnancy is not being managed properly by the obstetrician. Or if the baby is putting on too much weight but the mother is okay and the sugars are under control, still it is not a good sign. And likewise, if the sugars are not under control, then definitely it is not a good way to manage the pregnancy. So what are the problems that we come across? So there may be problems to the mother, like there may be fluctuation in the sugar levels during pregnancy because of the pregnancy hormones, and this may cause problems like she may feel tired suddenly, she may feel giddy suddenly, she may not be able to work effectively if she is having a job, and she may have to take rest on and off because of her fluctuating sugars. And second thing is like she may be required to come for checkups more frequently, she may be required to do blood tests more frequently. Maybe sometimes if the sugars are quite high, then she will be put on tablets, and also called as metformin and insulin, which will again bring the sugars under control, and she has to monitor it herself at home using a glucometer. So apart from these, she may have to go in for repeated scans to check if the baby is growing too much, if the baby is not growing enough, what is the water around the baby, which may increase because of the increase in the sugar levels. So coming to the baby's side, here the baby may be putting on a lot of weight. It can become more than 4 kilos by the time it delivers, and that is when we call it as macrosomia. The water level around the baby may be quite a lot, and this may again cause problems during the delivery. So because the baby's weight is more, the baby's delivery of the shoulders may be difficult, and we may have to do some emergency procedures to deliver the baby's shoulders, or we may have to directly do a C-section during this time. And because of excess water around the baby, which we call it as polyhydramnios, directly a C-section may be an option in such cases. And this is extremely important that we keep the sugars under control without much fluctuations, which may be possible only sometimes by adding insulin, which will keep the pregnancy smooth, which will give a lot of stability to the sugar levels, which will be in turn helpful both for the mother and for the child, though it involves a little bit of extra monitoring, and sometimes the dosage of the insulin may keep on increasing throughout the pregnancy. That is because of the pregnancy hormones and the treatment option that we give the mother. So first we start with the diet. So if the diet is working along with the exercises, so if the woman doesn't have any other complications where she is allowed to do all the physical activity, so we encourage her to do any form of physical activity, and along with that a strict carbohydrate free diet which will ensure that her sugar levels are normal. So diet is again a challenge for these women, because during pregnancy there will be nausea, there will be vomiting, there will be altered taste, so they may not be able to palatably use many of the food items that are available, and so they may stick to only a certain kind of food which may be easily digestible for them during pregnancy, which may be a challenge in itself. So in these kind of cases, we usually don't push them too much. We tell them to be more comfortable, because day to day they need to be comfortable with their body, and sleep is again dependent on their diet, so we want them to sleep well. So then if the regular diet is not able to maintain their sugars, then we go in for the next step of going in for the medication. So medications will be either tablets in the form of metformin, which can be increased by checking the sugars, monitoring them over a period of 10 to 15 days at home, and then we can increase the dosage based on that. Or we may have to add insulin, so that it kind of reduces the fluctuations of the sugar levels which can happen. So after the delivery, the baby may have increased risk of having low sugars and having increased chances of jaundice, which again may require an ICU admission or observation by a pediatrician. So all these needs to be discussed with the patient beforehand. So this is about diabetes during pregnancy. If you have more doubts, you can please comment on the comment box, and I will try to reply. Thank you.